So I saw this super interesting story in ProPublica last week, and I want to talk about it. It's about this 31-year-old guy named Chris McNaughton who has a debilitating disease called ulcerative colitis that causes severe diarrhea, joint pain, fatigue, and blood clots. Keeping the disease under control was costing Chris somewhere on the order of $2 million per year in medical bills. When his insurance company realized how much money they were spending on drugs, they decided to call his treatments medically unnecessary so that basically they could stop paying for them. In response, Chris and his family fought back with a lawsuit, which uncovered a huge number of documents from the health insurance company showing how hard they were fighting to decrease spending on Chris's care, even as the company was hitting record profits. Let's talk about it in this video. So Chris was a college student in his early 20s, enrolled in Penn State, when he started noticing multiple bouts of bloody diarrhea. He had health insurance through his family and saw a doc who diagnosed him with ulcerative colitis. This is a disease that causes inflammation and ulcers all along your large intestines and lower digestive tract, and there's no cure, so the goal of treatment is getting on medications to control symptoms so you can stop the disease from flaring. Most people have mild symptoms, but in Chris's case, his ulcerative colitis was really severe, like to the point where he was having 20 bouts of diarrhea a day that were bloody. He lost 50 pounds, he became severely anemic, and had to be hospitalized multiple times for blood clots. The disease forced him to drop out of school and spend most of his days indoors. Chris tried a bunch of dietary changes to control his symptoms, including eating the same diet of rice, Chex, and scrambled eggs for breakfast, and white rice with plain chicken breast for dinner. He went on and off a number of medications for 2 years, but kept having symptoms. And he eventually found a world-class gastroenterologist at Mayo Clinic who was able to get his disease under control using high doses of two drugs, Entyvio and Remicade. Both these drugs decrease inflammation in the gut and are usually reserved for the most severe of ulcerative colitis cases. After getting on these drugs, Chris's life was totally changed. He went from using the bathroom 20 times a day to only 3. He started eating different foods, and he was finally able to gain weight. He even enrolled back in Penn State, which meant his health insurance changed from a family plan to a school plan. And it was actually insured by United Healthcare, the largest health insurance company in the US. When he first signed up for United, a benefits specialist assured them that the two drugs, Entyvio and Remicade, would be paid for. And that was true for about 2 months. By the third month, the insurance payments for these drugs switched to pending status. The thing with Remicade and Entyvio that you have to know is that they're really expensive, like really expensive. The two together cost over $70,000 per year, and that's for average doses for average cases. Chris had a severe case of ulcerative colitis and needed extremely high doses of medications to keep his disease under control. 4 months later, his pending drug payments were switched to denied status, leaving him with a bill for about $807,000, and that was only for 4 months of treatment. The family immediately appealed, and after some negotiations, they were able to get coverage for the rest of the year. I mean, at this point, it could be easy to celebrate. I mean, Chris won over an insurance company by getting them to pay for his treatments for the rest of the year, right? Well, not really. Remember that ulcerative colitis is a chronic disease, which means you have to be treated forever to keep the disease under control. So even though they settled on coverage for 1 year, United was already planning their moves for the year after. Typically, when medical care is being reviewed by an insurance company, these companies will seek out a second opinion from another doctor. In this case, a gastroenterologist from UCLA reviewed Chris's case and got on the phone with Chris's original Mayo Clinic specialist who helped get his disease under control. The ultimate verdict from this second opinion doctor was that Chris's treatments weren't medically necessary and that there were concerns about the safety of using such high doses of medications to treat his ulcerative colitis. Now, I don't want to throw shade at other doctors, but let's just say that this doc did over 300 reviews for insurance companies that year and got paid $23,000 just to make these verdicts. I also think that it's sort of odd that the second opinion doctor brought up a concern over Chris's safety in getting such high doses of medications when those were the dosages required to get his disease under control in the first place. There's a lot of detail here that I'm going to leave out, but basically after a lot of back and forth between the second opinion doctor and the insurance company, United Healthcare ultimately decided that the medication as prescribed does not meet the medical necessity requirement of the plan. Basically, they were saying that they would only cover the medication but at a dose which Chris and his doc already knew wouldn't keep his disease under control. In response, Chris files a federal lawsuit claiming that United had a duty to find information that supported his claim for treatment rather than looking for ways to deny coverage. essentially saying that as an insurance company, the goal should be to look for reasons why medications are helping your patients rather than looking for ways to make a buck by reducing or eliminating care. Since the lawsuit, multiple documents have been released showing the degree to which this insurance company is fixated on price. For example, in one email, there is mention that United had paid out $1.1 million in claims for Chris's health care, and if they were to instead give him a reduced dose of his medications, they would only need to pay out $260,000. Another email sent to United executives mentioned that the insurance company had spent over $1.7 million on Chris's health care the prior year. Keep in mind, this is coming from a company that made a revenue of $324 billion with a profit of $20 billion under the leadership of a CEO who was getting $140 million per year in compensation. Chris's mom has this great quote in the article where she says that the health insurance company could pay for a year of her son's treatment using just minutes worth of profit, and she's not wrong. I think this story is interesting to me because it really puts some texture and granularity to the general hunch we all have that health insurance companies probably don't have our health and well-being as their top priority. It still amazes me to see the lengths to which America's most profitable health insurance company will go to avoid paying for necessary care so they can maintain their profit margins when they are already generating billions in profit and paying their executives millions in compensation. If you're interested in reading about the full story, I'll put a link to the article below. Thanks for watching.